Welcome to today's lecture on the pharmacology of generalized anxiety disorder, GAD, treatment. Generalized anxiety disorder is a common mental health condition characterized by excessive and uncontrollable worry across various aspects of life. Pharmacotherapy plays a crucial role in managing GAD symptoms, and today we will explore the various aspects of pharmacological treatment in detail. Benzodiazepines are effective in treating GAD by enhancing GABA's inhibitory effects in the CNS. Their metabolism involves hepatic processes and the formation of active metabolites. Variations in half-life impact their duration of action and accumulation potential, which clinicians must consider when prescribing for GAD. Selective serotonin reuptake inhibitors, SSRIs, are widely used as first-line treatment for GAD. These medications primarily work by increasing serotonin levels in the synaptic cleft, thus enhancing serotonergic neurotransmission. SSRIs selectively bind to and inhibit the serotonin transporter, preventing the reuptake of serotonin. This leads to increased serotonin availability in the brain, which can alleviate GAD symptoms. Additionally, SSRIs may also have downstream effects on other neurotransmitter systems, such as norepinephrine and dopamine, contributing to their anxiolytic effects. Individual genetic variations can significantly influence the response to SSRIs in the treatment of GAD. Polymorphisms in genes encoding drug metabolizing enzymes, drug transporters, and serotonin receptors can impact medication efficacy and tolerability. Understanding these genetic factors can help personalize treatment strategies and optimize outcomes. Pharmacogenetic testing has gained importance in recent years, allowing clinicians to identify patients who may benefit from alternative treatment approaches or dose adjustments based on their genetic makeup. The GABAergic system, specifically GABA-A receptors, plays a crucial role in the pathophysiology of GAD. GABA-A receptors are ligand-gated chloride channels that mediate inhibitory neurotransmission in the brain. Altered GABAergic function, including deficiencies in GABA synthesis or impaired GABA-A receptor function, has been implicated in the development of anxiety disorders. Various pharmacological agents target the GABAergic system, either directly by enhancing GABAergic transmission or indirectly by modulating GABA receptor activity, offering potential treatment options for GAD. Noradrenergic pathways, particularly those involving norepinephrine, are intricately involved in the regulation of anxiety. Abnormalities in noradrenergic neurotransmission have been observed in patients with GAD. Medications that modulate the noradrenergic system, such as selective norepinephrine reuptake inhibitors, SNRIs, can provide an alternative treatment approach for GAD. By increasing norepinephrine levels in the synaptic cleft, SNRIs enhance noradrenergic neurotransmission, which may alleviate anxiety symptoms in some individuals. The long-term effects of prolonged SSRI treatment in GAD are an important consideration in clinical practice. While SSRIs are generally well tolerated and effective over the short term, there is a need to understand the potential risks and benefits of long-term SSRI use. Studies have investigated the persistence of treatment effects, development of tolerance, withdrawal symptoms, and potential adverse effects associated with extended SSRI therapy. Clinicians must carefully evaluate the risk-to-benefit ratio and consider alternative treatment strategies for patients with GAD requiring long-term pharmacotherapy. Buspirone is an alternative anxiolytic medication commonly used in the treatment of GAD. Unlike benzodiazepines and SSRIs, buspirone acts as a partial agonist at the serotonin 5-HT1A receptors. Its exact mechanism of action is not fully understood, but it appears to modulate serotonergic and dopaminergic systems, leading to anxiolytic effects. Buspirone has a slower onset of action compared to benzodiazepines or SSRIs, and its use is often limited to individuals who prefer non-sedating medications or who have a history of substance abuse. In cases where first-line treatments fail or are poorly tolerated, second-line treatment options are available for GAD. These include tricyclic antidepressants, TCAs, atypical antipsychotics, and antiepileptic drugs. TCAs, such as imipramine and nortriptyline, have anxiolytic properties and can be effective in treating GAD. Atypical antipsychotics, such as quetiapine and olanzapine, may be used as augmenting agents in refractory cases. Antiepileptic drugs, particularly pregabalin, have shown efficacy in GAD treatment, although the exact mechanisms of action are not fully understood. Azapirones, such as buspirone and gepirone, are another class of anxiolytic medications used in GAD treatment. These drugs exert their effects through interactions with serotonin receptors, primarily the 5-HT1A subtype. Azapirones act as partial agonists at these receptors, modulating serotonergic neurotransmission and reducing anxiety. Unlike benzodiazepines, azapirones do not cause sedation or carry a risk of dependence, making them a valuable treatment option, especially for patients with comorbid substance abuse disorders. GAD treatment extends beyond symptom relief, encompassing improved functioning and overall well-being. Pharmacotherapy should aim to enhance the quality of life by reducing anxiety-related impairment, improving sleep patterns, and managing comorbid symptoms. Additionally, patients with GAD often require additional interventions, such as psychotherapy or cognitive behavioral therapy, to address underlying psychological factors and promote long-term resilience. Integrated approaches that combine pharmacotherapy with psychotherapy have shown promising results in comprehensive GAD management. Ongoing research aims to identify novel targets for GAD pharmacotherapy. These include neuropeptide systems, for example, corticotropin-releasing hormone, glutamatergic system modulators, and novel receptor subtypes. By targeting these alternative pathways, researchers hope to develop more effective and personalized treatment options for individuals who do not respond optimally to currently available medications. The exploration of novel targets presents an exciting avenue for advancing GAD pharmacotherapy. The integration of pharmacotherapy with psychotherapy is crucial for optimizing treatment outcomes in GAD. While medications can provide symptomatic relief, psychotherapy addresses underlying psychological factors contributing to anxiety. Cognitive behavioral therapy, acceptance and commitment therapy, and interpersonal therapy are commonly employed in conjunction with pharmacotherapy to enhance treatment response, provide coping strategies, and promote long-term recovery. Collaborative care models that involve close coordination between medical and mental health professionals yield the best results. In summary, treating generalized anxiety disorder requires a deep understanding of how medications work, their effects on the body, and the specific needs of each patient. Combining medication and therapy provides the best approach, and ongoing research offers hope for future advancements in treatment.